Everyone to this session of the Asia Pacific Financial Wellness Initiative webinar series. I'm so pleased to have a global panel of stellar experts to talk to this morning. But before I start, let me start by acknowledging that I'm coming to you today from the lands of the Wurundjeri people of the Kulin Nation in Melbourne, Australia. I'm now going to hand over to my wonderful partner, Mariko, to introduce our fantastic panel and carry on with this webinar. We'll be back soon.
Thank you so much, Vinita. Thank you also to our amazing panelists spanning multiple time zones, including the West Coast and East Coast of the US, India, Singapore, and Australia. I'm very pleased to introduce our moderator, Mr. Jaspreet Singh, Global Lead Financial Health and Innovations from UNCDF. He's leading the work of UNCDF globally on financial health, hosted through the Center of Financial Health and Living Labs. He will be guiding our panel discussion today, focusing on defining the terms financial health and well-being, as well as touching on approaches to measurement and collaboration across regions. Thanks so much for joining us today, Jaspreet.
Thank you so much, Mariko, for organizing this session, and thank you everyone who is basically taking out time to having this conversation. I think it can't be time better, especially with where we are living in terms of with the pandemic and talking on this entire conversation of, how do you help people recoup or, recover back in this pandemic time? Financial health as a concept has taken such a priority in all of these mainstream conversations happening across the globe that sessions like these or webinars like these are so important for, really reinforcing that idea and, understanding what that really means for developed and developing world alike. And it's a very new area of discussion. So before, I basically speak about what financial health is, we like to, really get an introduction of financial health from our esteemed speakers who are with us today and, who have been kind of dealing in their own different ways of addressing the issue of financial health and well-being as a concept, different from, what we used to earlier call as financial inclusion. So it will be good to, basically get a sense from them in terms of how they see this entire idea. Let me, start with my first speaker on my screen on the left side, which is Mimi, to ask her, what does financial health means for Financial Health Network? And maybe you can spend 2 minutes on also introducing yourself and the Financial Health Network in this case. Thank you.
Thank you, Jaspreet. I'm thrilled to be on the panel today with our partners and collaborators. At the Financial Health Network, we define financial health as when your daily systems help you build resilience and pursue opportunity. Our organization is based in the US. We are a national nonprofit with the mission to improve financial health for all consumers. We want to serve as a trusted resource for business leaders, policymakers, and innovators, united in a mission to improve financial health of their customers, employees, and communities. And we envision a future where all people, especially the most vulnerable, have the financial systems they need to be resilient and thrive. In terms of how we're organized, we have an innovation arm where we invest in early stage startups doing interesting things to solve challenges for consumers. We have a membership where organizations can join and be members. We do lots of research and analysis, which is available publicly on our website. And of course, we've developed a financial health measurement framework to measure financial health of individual consumers. We have a consultancy and as well an events platform called Emerge, which we've taken all of our thought leadership into a virtual space this year, which is available also on our website.
Thanks so much, Mimi, for that. And I think when we speak of financial health and this broader concept of resilience, all of this really zeroes down to the fact that, what are the business use cases which will help us, ultimately drive this. And private sector is much or less, on the forefront of, driving those business use cases, to kind of help us make the shift from inclusion to resilience and other outcomes. Let me, ask Ben and bring Ben in this his perspective on this. Ben is from Commonwealth Bank of Australia, which has been at the forefront of driving, what we are discussing around financial health and financial well-being. But I really want to ask you, Ben, not only what it means for you on both the sides, but if I look at financial health and well-being, there are also two different concepts altogether. It's a different mental model, where we talk of emotional well-being of people, and when you think of the well-being. But when you think of financial health, you can really size it out in terms of the very focused health indicators, which helps you track different outcomes for your consumers in a way, right? So what does it mean for you, Ben?
Yeah, thanks, Jaspreet. And I really like Mimi's very simple, concise definition of financial health. I think that's great and very helpful. At CBA, improving the financial being of our customers and communities is our purpose, and it's what we're about. And we think about financial well-being in terms of financial outcomes. And so over a number of years, we've worked with the Melbourne University to try and put a definition around our purpose and also build a measure that we can track whether the things that we're doing are working, and also where are the opportunities and problems. And so the broad definition is the degree to which customers can meet their obligations, make choices to enjoy life, have resilience in adverse circumstances, looking both at today and future situations. And we really measure it in a relative sense. So it's like against the rest of the population, as to putting it like an absolute measure of financial being. And one of the things that we've learned from this process is that there are lots of things that are important for financial being, but one of the things that was quite surprising and quite encouraging is that behaviours and decision-making really matters. And that's something that we think the bank can particularly play a role in. In terms of why financial being is important, I think it's important for individuals, communities, and it's also important because it's such a stubborn problem. In terms of individuals, Mimi talked about it impacts opportunities, it impacts communities in terms of, money is a big impact on relationships and families. And it's a stubborn problem because we see, not just in Australia, but right across the world, progress, there's a prosperity paradox. There's lots of progress being made with productivity, with access to financial products and systems, but there's not a lot of progress being made in terms of financial being. There's still a large percentage of the population in Australia, and I think around the world, who are just experiencing negative outcomes on different measures, whether it is resilience, retirement, debt outcomes. And then moreover, I think it's very important to our organisation or organisations as a bank. So it's important to trust advocacy, productivity, profitability and growth. And we really see that, our business is fundamentally tied to our customer success, and we've seen suggestive evidence around a strong relationship between things like net promotion, complaints, profitability, risk, and advocacy and retention with customers who have stronger financial being or poor financial being, and when it changes.
Thanks, Ben. I think this will be a very useful conversation to have maybe in this session as well. Trying to understand, what is basically driving CBA's entire initiative around championing the financial well-being approach in a way. Not only converting it as an opportunity for your consumers, but also, in terms of from a business standpoint, how do you see this? Because oftentimes, we get into this conflict of, is business looking for a shareholder value and maximize profits in a way, or, or is this more of a long-term thing, which has to be dealt in a very different light altogether? But before we go to that, I'd like to speak to, Ida and bring her into this thing. Ida has also been, part of the working group that Queen Maxima has set up on financial health. So I'd like to, really understand, Ida, that the outcomes, which has been very defined as a critical part of financial health as a definition, right? How does Aspen looks into this, right? And what are those outcomes that, you see are, composite of what makes financial health, right? Is it a singular outcome, or is it a multiple set of outcomes which comes together to make financial health or well-being as a concern? Ida, your mic is, sorry.
I'm on mute. I was being very good and forgot about that. I want to thank you, Jaspreet, for moderating us today. And also thanks so much to Vanita and to Mariko and the APAC Financial Wellness Initiative for having this conversation. It's really timely. The Aspen Institute was formed around 70 years ago by business leaders looking at critical challenges facing society in the aftermath of World War II. And about 6 years ago, I came and really re-engineered the financial security program, because I do think that financial insecurity is one of the most critical financial challenges. It's one of the most critical challenges facing society, not just the economy, but democracy. Because when you have instability at the household level, the levels of which we saw during the pandemic, you see just how quickly that can destabilize and have a ripple effect through the entire economy. And so as we think about new capitalism, as we think about stakeholders and shareholders centering around financial health and wellness as one of the building blocks of a strong and vibrant and resilient economy, feels like not just a nice to have, it feels like an imperative. And the other reason that I think it impels us to go beyond financial inclusion, because as you were saying, there's ways that the rest of the world, we've gotten very good at counting access to specific kinds of accounts, to access to payment platforms. But now that we can measure financial health and well-being, we see that not only in developed countries, but in developing countries, inclusion in and of itself isn't sufficient. And we can actually end up with high levels of inclusion without ever actually improving outcomes and well-being and stability and security for households. So that is why this conversation is so important and why it's great to be part of it. I would say the other part of able to contribute to this is when the Consumer Financial Protection Bureau in the US took on the consumer-driven definition of financial well-being for the US, the Financial Security Program's Director of Evidence and Insight, Genevieve Melford, was really leading the charge on that for the CFPB, and I was the contractor that drove that work. So it's really kind of coming full circle, and worked very closely with Mimi and the Financial Health Network, and later with the OECD and others to help to really try to disseminate this as a tool for other countries to start talking about. So again, a pleasure to be here. Now that you're the one on mute.
Sorry. I think it's a pleasure to have you actually on this conversation. And what struck me when you were saying that even when Aspen Institute was formed, and we're living in a new world altogether, what we like to also understand at some point of time in this conversation is this entire debate which is happening, that fair enough, that GDP or maybe income is not the good measure of, where are we resilient or not, right? And if financial health is that measure, or, it provides you that measure, right? How do you basically, create that correlations, right? Because oftentimes, now as we are taking this conversation away from theoretical, from theoretical package to more of practical experiences for government and policy makers, how do you draw in those connections very closely upfront? So it's good to talk about, Aspen's work in this space and, understand how you've been able to how you're thinking of doing it. But before we do that, let me get Badri Narayan in on this conversation. Badri has been leading some of the interesting work in the space of building correlations and, a lot of research in the field. Badri, quickly, your 2 minutes on, what financial health means for you. But you have to unmute yourself. But Badri, you will have to unmute yourself.
Yeah, I was trying to unmute. There was some issue.
No
yeah, I'm really delighted to be part of this panel. And thank you very much, Jaspreet, for moderating it. And thanks to Mariko and Vinita for organizing it. I also thank all the panelists for their wonderful points. In fact, I would just briefly talk about our organization and the work we are doing in this area. So I'm running a consulting firm called Infisum Modeling. We're based here in Seattle, but also we're also present in India, China, and Canada, and a few other countries. So we are currently partnering with Mariko and Vinita to come up with a research and report on financial wellness as a concept. So that's an area that we are working on currently. But in general, we work a lot on policy research and strategy research using data analytics and economic analysis. So on this aspect, financial health and financial well-being, we are looking to develop a concept of financial wellness for the regional ecosystem across the Asia Pacific. So what we are looking to develop is a higher level of conceptualization compared to the existing definitions, which have evolved over time, particularly like financial inclusion, financial capability, and financial health and well-being. So looking at the definitions of these and then making it an all-encompassing aspect. So we are developing this concept of financial wellness, which basically takes into account the access to and usage of finance, and financial knowledge, skills, and behaviors. That is basically all about capability. Then financial security, resilience, and confidence, which is basically what we think in terms of financial health and well-being. So we're looking at all these different aspects, and also putting this together for different layers of the ecosystem. We're looking at the individual level, family household level, then the local community level, and the business level, workplace and business level, then coming to the national level, and finally global level. How do we look at these different layers and the variations and the inequalities between these different layers? And this is what we have been working on currently, and it is more of a new conceptualization, and to enable the entire ecosystem to collaborate, so that we can improve the financial lives through collective actions. So I really like the idea that Jaspreet mentioned about thinking of financial health, financial wellness, these concepts as being better indicators of economic and social well-being, rather than GDP per capita and so on. I think this kind of analysis might result in kind of inducing thoughts along those lines, and I'll be happy to discuss more about our work as we go forward. But now I'll keep my response brief.
No, thank you so much, Badri. I think we'll come back to that in a moment, because the bigger question is also that how do you measure it, but also that how do you make it comparable across different parts of the world, right? Because it is sometimes so contextualized to a local environment that can you set up a matrix where you allow it to have that comparison which goes from one market to the other market. And I think possibly this was why we all landed up focusing on financial inclusion and then access and usage to be the only critical benchmark, right? Because it was so easy to measure it to begin. Governments and policymakers could really pick up one indicator and they know, okay, we need to run behind this, right? But now when they have kind of reached a certain point of inflection, everyone is wondering is where next, right? And this was very well said in one of the meetings by the governor of Central Bank of Kenya. He said, I will open 99% bank accounts in my country and give insurance to everyone. Then what? Where am I supposed to head out with this, right? And I think this is where it all kind of falls back, and they were saying if you can't measure it, you can't improve it, right? So going back to that business use case, I'll start again with Mimi on this. Mimi, you have been at the forefront again with Financial Network on working with private sector in the space, right? Trying to help them unpack the business case, or basically integrate the behavioral approaches towards building a financial health centric products and solutions. Possibly not products, I will say, because it's supposed to be product agnostic in many ways. How do you see it? That journey evolving, but then what were some of the challenges that you felt was that you were facing in very early days of Financial Health Network, and the businesses trying to accept the very idea, okay? And then where did the entire aspect of index which the Financial Health Network has built with plan, save, borrow, and spend came into perspective, and how did it help you make the case better with your private sector players? Maybe over to you.
Thank you. I'll try to answer this in components. The first point that you've made is what gets measured gets managed. So even if you look at this on a global scale, if there's a mandate to measure financial health, regardless of whether the methodologies are the same, it just drives the attention and awareness as another data point. The other thing I will call out is financial health is not a static situation for consumers. It's very dynamic, right? And so there are components to financial health. There's an aggregate score that we've developed. And then, as you've pointed out, there are components across spend, save, borrow, and plan. And so consumers might be strong in one area, but struggling in another. So it's important to look at it in a disaggregated manner. But I think the important thing is whatever the measurement methodology is it helps to understand the populations that you're best trying to serve. So at an aggregate level, what the overall financial health is in a particular corporation or for a customer base or whatever population you're serving, and then disaggregating that information among different communities, ethnic communities, age groups, men and women, because the financial health dynamic changes. And then to the third point that you've asked, and I want to make sure I'm catching all of these, is that we really think it should be a KPI. When an organization looks at their performance, that this should be a key performance indicator as they consider either the employee base that they're employing or the customer base that they're serving, and that the measurement component is critical to that. And that will filter into product design and service development, because you need to know before and after whether you're really moving the needle on financial health of those that you're trying to help. So I'm going to pause there to make sure that I've answered all your questions. Did I miss?
No, absolutely. It was really helpful to have that perspective to begin with. I think I'll just kind of like to further ask you something on that. Especially to understand that, once you have established that, index of financial health that FHN did, and, you have interested private sector players to, come forward and build use cases, right? How have you been able to translate that data or information, and helping them kind of build the right services in a way, one. And second, what were some of the challenges that, you saw with the private sector players in, adapting that understanding? Right. I'm sure, it would have been a journey which would have taken, a long period of time, before you can convince them to really see in that same vision or the same light, right? What were some of the aspects and challenges which, you have gone through? Because I think this is, where when we take this from the realm of a theoretical world to a more practical, setup in a developing market context globally, right? These are the same challenges that every market will be facing. It will be good to learn, how you see how you got to experience those challenges, and what has been some of the learnings.
So I'll say that for many years we had to explain. We would say to organizations, you really should care about financial health, and here's why. And we get a lot of nodding heads, and it sounds like a good idea. But with the pandemic and the resulting economic crisis, we have been able to absolutely skip across why any organization should care about financial health to a conversation around what should they do about it. And based on that, oftentimes the first step is to measure. you have to understand the state of where your customers and employees are now before you can innovate and offer solutions. So you've got to take a baseline measurement. And so that unfortunately or fortunately, the current crisis has really helped organizations understand why financial health matters. In terms of how organizations use the financial health measurement, there are a variety of ways, but we have found that those that are most successful use it as an engagement tool to really engage their customers or their employees to say, let's have a conversation about your financial health, talk about what your needs are, and then from there, talk about the products and services that would be best suited to you, as opposed to just trying to open more new accounts, or other metrics that an organization might use. And I can say that certainly Commonwealth has been a great partner in this. And I would say among the organizations we work with, they are really at the forefront of measurement and then actual taking action as a result on that, and testing and deploying products and services.
Interesting. I think it's important to not only kind of continue reinforcing this entire dialogue process with your partners to help them shape that right understanding of the vision. But I think I'll definitely agree with you on this point that somehow this pandemic has accelerated that need. This conversation, the reason why we are having even this conversation right now is because this pandemic has somehow accelerated that entire process one way or the other across the globe. Going back to Ben on this very question of how private sector businesses should be looking at this. And Ben, you are in a very interesting position because you are a enterprise, a bank in Australia, who has been actually at the forefront of adopting the entire vision around financial well-being in a way. I think I'll not go into the idea that how do you convert that into opportunities for your consumer to begin with. But what I'd like to start understanding is, how did you make your bank convinced at the first place to basically take that as a vision, champion it within the institution itself, right? What were some of the again learnings or challenges that you have to go through convincing the management at the most highest level, because this will not really happen if you do not get championed at the highest level to really drive and go behind your efforts on this. And then banks are obviously, we know, works in a lot of silos in different ways. I've been a banker myself in my past life, so it's very difficult to basically get everyone on board. So I'll be very pleased to understand that experience that you have gone through on this, Ben.
Yeah, happy to talk about that. And I think you're spot on. So fortunately, probably back in 2017, Matt Common, who's now the CEO, was very focused on how do we accelerate and bring what was the vision back then to life for customers and just do more around that. And so myself and one of my colleagues, Mo Khalil, and another colleague, Will Mailer, the chief behavioural economist, were talking about the paradox and why a new approach was needed. And fortunately, he was very open to that and very supportive of setting up a new approach across the bank. And that new approach was essentially that we needed to start with a blank sheet of paper, look at what the evidence suggested would help improve financial well-being outcomes for customers and communities, trial things to figure out what worked and what didn't work in our context, measure to understand where the problems were and what things were working, and then really drive innovation off the back of that, drive that into the product experience and policy development for the bank. And so thankfully, we've really had his support for the last number of years. As you mentioned, without sort of top-down support, these things are very hard. Just going back to your earlier question, I think we've really tried to turn this from the traditional zero-sum game thinking where shareholder returns dominate to really the customer and the shareholder outcomes are aligned. And we've tried to build belief and evidence of that over time as we've run experiments. We've run randomized control trials, and we've measured both customer outcomes and commercial outcomes to show that these things actually can be aligned And then and we've had plenty of examples. You know, I can probably think of half dozen to a dozen examples of that. And yeah, I think the other element is we have you know, the regulator asking for a stronger view of customer outcomes. So, you know, so we can have kind of this triangle of measures. So we're looking at profitability, we're looking at risk, we're looking at customer advocacy and desirability, but we can also look at customer outcomes of these things helping customers.
Interesting. Just to also, you know, catch up on what you were just talking about, you know, this entire championing. And I was just wondering, you know, is this a journey? You know, because banks play, you know, multiple roles, you know, on different functions. Now, you know, to basically imbibe that idea of behavioral understanding of the customers and, you know, the customer needs, and to be able to appreciate that, right, across all the various functions of the banks. You know, does it happen? Has it happened already? Or, you know, is it's something that you see this as a journey and which eventually will help translate and, you know, bring down this entire conversation within all parts of the banking function over a period of time?
Yeah, it's certainly a journey in our experience. But I think in terms of the sort of the broader employee base, CBA probably has 50,000 employees. I think it's something that's really inspiring and motivating for the entire employee population. They really want to be doing the right thing for customers. So I think it's, you know, it's a very exciting thing. Obviously, incentives and leadership is really important, but we've really seen all of our employee base wanting to make a big difference in terms of financial outcomes for customers in lots of different ways.
Thank you so much. I think that's an important point, because, you know, you can only as long as address the needs of your consumers in the right way, if you're able to convince your house, you know, internally across the broad spectrum of people that you want to work with on that. So thanks so much, Ben, for that. Going back to Ida, you know, we started this conversation. You mentioning of, you know, how Aspen Institute kind of evolved, right? I'm kind of familiar with some of the programs and projects that you are doing, especially around the Apac or consumer insights work or retirement saving. I'd like to understand, you know, how, from an Aspen's perspective, you know, what have been some of the learnings that have allowed you to build the correlation between financial health or well-being outcomes and, you know, some of the learnings from the different initiatives that you are running, right? What are those specific aspects of those outcomes which are important in short term vis-a-vis long run? You know, that kind of you speak to.
Yeah, I'm gonna take that hopefully quickly, but in a way that complements what Mimi and Ben have already said. I think that part of what is provocative and potentially transformational about measuring and talking about financial health and having the private sector lead on it is it actually implicates a lot more actors. It actually goes deep to the heart of a social contract, no matter if you're in a developing country or a developed country. And so while we have layered on understanding about financial challenge after financial challenge after financial challenge facing a household, at the end of the day, a private sector firm is going to focus on its customers, and it's going to be a choice whether they expand the kind of customers they're hoping to serve or not. They could measure financial health of their existing customer base and stay right there and improve it. But of course, the way this has to connect with financial inclusion is that we're talking about needing to make sure that everybody is able to participate in the economy as a producer and a consumer. And so that's where policy and another piece comes in. So what we did the last year was really try to think holistically about, from a household perspective, what it takes to move the needle on financial security, financial health. And I'm going to share my screen for a minute just to walk through this easily. I think this will work. You tell me, can you see a house? It says financial security.
Yes,
framework?
We can.
Okay, great. So we put out Financial Security 2020 this year, and even though we did do it for America, the first folks to start using it was FSD Kenya. So I felt good about that. I think that there's a lot of implications here. When it comes to a household and how you build again, that sense of both short-term stability and long-term financial security, there's three components. There's a sense that a household has routinely positive cash flow. So this gets back a little bit to the measure you talked about, is income really sufficient? Well, when we talk about routinely positive cash flow, what we're really talking about is income that's exceeding expenses at any given time, and understanding both the labor and non-labor components of what income really is for a household. And then also understanding expenses. When we do our Expanding Prosperity Impact Collaborative work, and the last time we did a 2-year round on this, all three of the topics that rose to the top were about rising costs. So of course there is issues of income volatility that happens in all countries, but there's also this sense of rising costs. And so there's a piece there. The second part of what we know about financial security, and we see this through the measures in financial health, is personal resources. We know when the CFPB measured what correlates most strongly with financial well-being scores, liquid savings was number one. It was even more strongly correlated with financial well-being than income. And so thinking about financial resources, both as savings, as credit, as private insurance, as financial wealth, even your retirement savings, and we've just done some other research there. That's the second pillar, personal resources. And the third is public and private and benefits. So this is, again, we saw this a lot during the pandemic, the need for cash transfers, how that's coming into play right now. That implicates the financial services industry in a very different way than the products and services they're delivering. It's about the pipelines and the rails for that work. So I think that, I'll say that, and that's all available. I'm sure in the notes we'll share what the link is. But I think what this is saying is that if we're truly going to take action on financial health, and this is where the financial security program comes from, it's going to implicate many more actors than financial service providers. And that means that we're moving toward really strategic thinking about public-private partnerships, around the needs to reinvent a social contract, to think about the bundle of benefits that people really need for stability and mobility over time. And that happens in both developing and developed countries. And I think that that's the other thing that we've been talking about, is there's a real great convergence. There's a real shared learning agenda coming out of our journey to this work. And that's what's exciting about conversations like this.
Oh, interesting. And just to kind of, I think take the leap from what you were just mentioning, because we were internally also, looking at how to look at financial health as a concept. And, we have to kind of start with that very focus at outcomes and the determinants, and I think you were largely speaking of the determinants, which are affecting or impacting the outcomes, right? And through different pathways, obviously, right? And private sector is obviously one of it, but it has to be think at multiple levels with various actors. We'll come back to it in a moment, Ida. And I like to bring Badri into this conversation, because Badri, it will be, you've been talking early on the work that you've been doing, trying to establish that entire relationship between what does financial wellness and well-being means in a real economy perspective, right? What I like to understand is that what have been some of the learnings from your current initiatives that you're running, one. But second, at the same time, as you pick up from what Ida was just mentioning, that you think of this at various levels, right? And if we have to think of making this comparable across different parts of the world, right? What would be some of the aspects that you have learned and come across in with your work, which we can really learn from? Badri, over to you.
Thank you. So on this aspect, all the discussions so far with the other panelists have been really helpful. So there are various ways of looking into this. So the way we are looking at the whole thing, all these different layers, different concepts, is focus on the some of the bigger developed countries. You have pretty good data, so you can do analyze them and do some comparisons. For the developing countries, the data is very limited. It's available for a few countries and not available for others. So the approach you're taking there is to take some representative countries for a given geographical region and development status. So for example, in South Asia, we would look at we'll have three groups, developing, least developed countries and developed. So obviously there are no developed countries in South Asia, but the other two groups you'll have countries. And even if you don't have data for each and every country in those subgroups, you'll have at least one, and we'll focus on that. And then the next point is, even after doing that kind of representative analysis, looking at one country, there are things that are very specific to countries, and it's difficult to harmonize, difficult to look at them in comparison to others. That is where the explanation comes into picture. So we have to explain as to why this is standing out, and so on. Like why, and sometimes even for the developed countries also. We for example, in Singapore, we had kind of an interesting observation on the ATMs, number of ATMs per person. That was actually pretty low, and we thought, and we all know that Singapore doesn't have that issue. Like they do have pretty good financial infrastructure. So then we found that it was because Singapore is quite the density is very high compared to other developed countries. So the way to look at that parameter is different. So then we try to normalize this with population density and so on. So that is the way we are trying to capture like all the different peculiarities of different countries, and take them into consideration. And at the moment, we do have a lot of gaps, but whatever we have been working on, but at least we are trying to identify the gaps and trying to explain them within the context of the uniqueness of each country or each region, and that's how we are trying to piece together all the the different pieces of the puzzle. And yeah, we are right now almost gathered together different parts of the report, and we are going to share with all of you the draft report in the next few weeks. So then we'll look forward to your thoughts and comments as well, because this is going to be a work in progress. This is going to be like a very first attempt from our side. But we'll need a lot of refining. We also have like the nice point that you mentioned, Jaspreet, about this report is all about outcomes, looking at outcomes of different countries, but we also want to eventually investigate the pathways to the outcomes, the determinants and so on, and that is only possible if you look at one country at a time, because the paths are very different for different countries. So those are things in our mind in the future. Like after we do this, this is something we are just doing as a first effort, but we want to do a lot more work on this, and I would like to collaborate with all the panelists here, institutions here.
No, thanks, Badri. I'm sure the report will be really insightful. You've spent a lot of time in trying to understand data and dynamics of how data can be understood in different market contexts. Right, it'll be good to see what insights we can generate from there, and maybe how it can help us from a policy perspective or from a business perspective, for different stakeholder groups that we'll be reading that. Going back to Mimi, maybe for the one last round of conversation with everyone. I was quite curious, when we started this journey, even at UNCDF around this financial health, one of the things that we were constantly reminded of that. Yes, the concept into focusing on it, but from a business perspective, you're building the use cases. There was a sense of that how important behavioral understanding of the consumer is about how they look at different things, right? The entire concept of behavioral science, in a way, and then how do you overlay data along with it, right? So I like to really gauge from maybe both Mimi, you and Ben in that way. In terms, how do you see the entire aspects of behavioral marrying the data, and how you've deployed it to your different contexts with your different participants of the program, maybe especially in case of CBA, but broadly with your program, Mimi. If you want to speak to that.
Certainly. So we're running a national research project called the Financial Health Pulse, where we're measuring financial health across the United States using our measurement framework and a more extensive survey. So there's a subjective survey, and as well as for respondents who are willing to opt in and share their transactional data with us, we can capture that. And we are also working on incorporating credit data here in the US. And we believe the use of that administrative data along with the subjective survey results will really give us a unique point of view into what's happening in consumers' lives. This project has been running now for 3 years, and it's being run by the University of Southern California at their Center for Economic Research to make sure that we get the broad demographic sampling that we need. And every time we survey, we capture 5,000 to 7,000 responses that really help us understand what the trends are in the US.
Interesting. And then I believe you deploy those trends to build your use cases with the private sector players in the US context, right? And basically guide them to take the right decisions. Got it. Okay. How is it also used for broader policy making purpose yet, or it's more suited to kind of guide the private sector to take right decisions, or do you think there's an element of policy making built into it?
Primarily, the work has been focused on the private sector to give them a benchmark, encouraging them to measure financial health and using this larger body of research as a benchmark for their own data. But just recently, our CEO, Jennifer Tescher, has made the case that there is a case for policy to have a standardization around financial health measurements, certainly within the US and perhaps more broadly. So we are starting now to really kind of take a more policy-oriented focus on that.
Interesting. Ben, maybe the same question to you as well, in terms of how do you look at the entire space of behavioral and data together, whether it's, informing services or even, driving your internal policy making at the bank?
Yeah, I might answer 2 parts of that. One is on the measurement piece. I think like Mimi, we're trying to do very similar things. We measure observed or objective financial being for about 50% of our customers every month. We look at a range of data features that overall give a signal on the latent variable of financial being. And we also try and link that through to survey-based score on financial being, reported financial being. We use that as a sort of a monthly measure that goes up to the leadership teams, the board. It's available to product teams for development of different features. And we're also just starting to put it out into the public domain for policy discussions. The second thing I just wanted to pick up on was, I think Mimi's comment earlier about the sort of the financial system. So there are 2 big behavioral elements we are thinking about, 2 hypotheses. One is that the default setup of the financial systems of our customers and citizens is a huge determinant of their financial outcomes. And we really want to start thinking about how do we, from a choice architecture and from a financial systems theory or a systems theory approach, how do we better design or restructure that system to allow humans to get better outcomes? And then the second piece I wanted to pick up from Ida was around the sort of the collaboration and the public-private partnerships. The other big hypothesis we've been looking at is, particularly for people who are in real financial stress and relying on government support and the unclaimed benefits problem, the hypothesis that we really need better public-private partnerships and better collaboration around industries to improve access and reduce the administrative burden for citizens accessing these benefits. And one of the things we've started doing is an initiative called Benefits Finder, which just tries to use our data, technology, and relationship with customers to connect them to government support, social policy support that they're eligible for. And we've really leaned heavily on both our behavioural science team and our digital teams to come up with some innovations. But I think we've only scratched the surface. There's a lot more opportunity there if we can partner across private and public sectors.
No, thanks, Ben. I think I was quite, informed when I also saw your tool on the website, where you can, as a consumer, go and, put in your, there are certain questions which kind of pop up to you. And then, as a bank, you are basically proactively telling them what are their challenges, and what part of financial outcome they are, really weak on. And then you kind of create a structured products or services around it. So it's quite interesting to see, how you're doing it in a real life example in a way. Going back to Ida again, Ida, you basically alluded to this, that, the public-private partnership will be important, as we move forward with this. But you have to ask, maybe those, if you have to set up a call for action, right? What will be those, top 2 or 3 things that you think should be, the need of the hour, and that we should kind of, work towards in order to make financial health and well-being conversation more mainstream, especially in context of not only developed world, but also developing countries, where these conversations are just not happening. We are still yet to see them, starting up. There are only handful of very progressive, possibly policymakers and private sector players in some of these markets who are even started thinking on these lines, and they are yet to, figure out how they should kind of go about with this. So what will be your call of action, in terms of the 2 or 3 things that policymakers should be thinking of, and the private sector maybe should consider as they move forward with this?
Yeah, thanks. I'll try to be brief on that. I think we have, as a global community, it hasn't been that long since we really pushed in the Sustainable Development Goals for financial inclusion to be a part of the works. And there are so many countries that have done financial inclusion strategies that the World Bank has supported because of that. So I think that we do have to recognize that we've really pushed for folks to look at access as the metric, and that they're going to need, and all countries are going to need, a lot of support and a lot of new tools if we're going to get them to be able to take the next step and understand that the toolbox in many countries is quite limited in terms of beyond measurement what you can do. So I do think that's where the importance of private sector innovation comes in, the importance of private sector leadership. There's a whole set of complementary technologies that's going to matter in that regard, right? Digital identity, how we think about the baseline technology to help systems be interoperable. So, I don't want to get too far down the weeds there, but I would say, Ben, to your point earlier about what you're doing now to understand social safety net and the kinds of ways that you touch half the population of a country, as a private sector firm. There is a lot of things outside of the scope of your traditional product set that potentially could be done, or that you would know how to do and get them there quicker. And I think that that's putting that in the public domain as one explicit call for action and one wonderful thing. I'm putting a link up. We just did a scan of the fintechs and the tech companies, because the safety net in America has been broken for so long, that have created workarounds. And we're bringing them together with the White House as we think about new cash transfers to households in an ongoing way over the next year. I think the main thing I'd call out, I know we're coming to close, is, we held a working group last year parallel to the United Nations working group that Queen Maxima was leading. Ours was really about, it was almost an answer, right? The Queen Maxima's group was really very much around the measurement and action taking, public-private, around financial health. And then this question of then what? So if we have the number, what do we do? The paper that will be coming out from the United Nations that you just talked about will be coupled. We'll be putting out a paper from our working group at the same time around building inclusive financial systems, and really expanding what we mean by what kinds of companies and what kinds of systems have been financialized and matter for people's financial health. So I think that in both of those, there's a real call to action. There's a real call to action for naming a shared learning agenda, sharing information at a detailed level, and working together, I think, especially around the next generation goals with sustainable development that get toward financial health, both in terms of what we know about it and what we can do to address it. So in my sense, those are high level things, but it's an important piece. I think the last thing I'd say there is, I want to make sure we don't hone in just on the parallels of financial health and individual agency around health. I think we should also think about public health, especially out of the pandemic, and think about the parallels to public health for financial health. So what are the ways that we need to think about the systems that create resilience and stability at a public health dimension, not just about individual health and well-being. And I think that's going to help us go a little further in the policy dialogue as well.
Oh, interesting. That's really helpful in terms of the perspective that you have placed in front of us, Ida, and I fully agree with you. Possibly, the bigger question is also that would it take us to mainstream this work around financial health, in the same way that we did with financial inclusion? It took us a decade and more of effort to really make financial inclusion what it is today for a lot of governments across the world, especially also the private sector including, right? And given the state of pandemic and where we stand, possibly we don't have enough time in hand to do that, right? So how do we really accelerate this process by ensuring that whatever is being done across different parts of the globe can be really brought together and basically make it much more conversant for the developing countries and help them adopt the agenda in a way from different angle.
Like the leadership of Financial Health Network, Commonwealth's work that you're putting out in the public, and the kinds of measurement tools that Badri is doing are that plus conversations like the ones APAC Financial Wellness Initiative is hosting are I think going to help us accelerate.
Oh, absolutely. Absolutely. And Badri, any last word from you on this before I hand it over to Mariko and make it a close?
Yeah, thank you, Jaspreet. That was a great discussion by all the panelists. I think from our perspective, what we are thinking is to take it to the next level, to the policy. First thing we are planning to do is to disseminate this report, of course, among all of us here and also other partners. We have been doing a lot of other work, which is not into finance, but more about economic recovery from COVID. What are the different policy options there? Green sustainability, sustainable recovery, green recovery, and a wide range of topics. So what we are thinking is to take this and say that this is a very important aspect of all this recovery discussions we are having, and all of this are about policy. Like all these are from international organizations like ADB, UN, World Bank, IMF, and so on, and they're all coming up with policy prescriptions for coming back to the recovery path. And this is conspicuously missing. Discussion on finance is conspicuously missing there. So we talk about many other things, but finance is less being discussed there, at least in the initiatives that we are working with many organizations. So the very first low-hanging fruit that we want to think about is to say that this directly fits into all the work we have been doing. So why don't we think about financial aspects as well, financial wellness, health, and so on. And we have some initial findings here, and we can take it further. And the policymakers, if policymakers like you earlier mentioned about GDP, they always want to think in terms of how does it matter for the economy as a whole. So there's some analytics need to be done further beyond what we are doing to basically say that these are different ways of affecting your bottom line for the economy. And this is a big trigger. Like this here we are talking about not only about income of some people, but also consumption that is going to be boosted from there, investment that is going to be coming from that, and so on. So there are a lot of macro implications of this. And I think if you take the dialogue in that direction, saying that this inclusiveness or financial wellness, health, this is going to basically matter for the whole economy as a whole, and
right.
then it becomes more interesting for the policymakers. And on the private sector, I think many of them are. We are also collaborating with many private sector fintech partners, particularly. Then they are already into a particular topic, and they're finding the gaps that currently exist and doing their best. And they also may be very, they'll benefit a lot from all the discussions we're having here. And I think that's the way forward from our perspective.
Absolutely, point well made, Badri, on this. And I think we also kind of running out of time now. So thank you so much, everyone, for taking time out for this conversation. I think I can't agree more than, that if we have to have a real call for action, it's about also trying to bring together the learnings that everyone else is doing and working across different parts of the world, right? And kind of start disseminating and sharing it, and keep pushing it, this further the envelope of financial health and well-being as a concept, and, really ground it in a real economy context in different markets for policymakers and projectors to really adopt it. So thank you so much, everyone, for, taking time out and having this conversation. I'll hand over the floor back to Mariko.
Actually, Vinita, you
Vinita.
go ahead.
All right.
No worries. Thanks to everyone. That was such a fantastic conversation. And I really hear the call to action. And for us at the Asia Pacific Financial Wellness Initiative, the call to action first was to invite people like yourselves, bring yourselves together. Second, for us to grow this so that we can genuinely create an ecosystem, the regional ecosystem that we're trying to create across the Asia Pacific region. And third, last but not least, what Badri is working on, to be able to find a role for every layer of this ecosystem, something that individuals can do, something that the local economy can do, the national economy, and then the global ecosystem, because we genuinely believe that everyone has a role to play in improving financial well-being. So to me, this conversation that we're having today, plus the next step that we're going to take, is a fantastic call to action. And I'm so grateful to have all of you today. And for the final wrap up, over to Mariko.
Thanks so much, Vinita. First of all, I just wanted to thank all the panelists and the attendees, and we hope that this dialogue will help pave the way for more collaboration and discussions in the future. At the APAC Financial Wellness Initiative, we're very happy to assist in any way your organizations from an APAC point of view. And to our audience, if you're interested in learning more about the APAC Financial Wellness Initiative, you can reach out to us through our page on LinkedIn. Thanks again, and we hope you all continue to stay safe and healthy.
Thank you so much.
Talk soon.
Thanks so much, everyone.
Thank you all.
Thank you, bye.